Nigeria budgeted the sum of 2.48 trillion naira for the health sector, representing 51.8% of the total 47.9 trillion naira proposed budget. That ought to transform the health sector. It's therefore shocking when the health minister told the House of Representatives that out of 218 billion naira capital budget, a mega sum of 36 million naira was released.
The last money that we had grant for vaccine financing was 2024. Even that was not complete. Yet we have continued to immunize Nigerian children to protect them from diseases. We have outbreaks that will protect Nigerians. We did a massive measles and rubella campaign. But the counterpart funding that Nigeria should put is always late in coming. How do you explain that?
0.016% was released. Where is the other money?
However, this is not a problem. Records show that this is a recurrent trend. In 2022, 134.7 billion naira was allocated for capital projects. However, 87.3 billion naira, that is 45%, was released. Going over to 2023, 134 billion naira was allocated for capital projects. However, 40.4 billion naira, which is 30%, was released. That is 10% down from the previous year. And if you look at 2024, 434.8 billion naira was allocated for capital projects. However, 65.4 billion naira, which is 15%, and further 15% down from the previous year, was released. Specifically for 2025, 402 billion naira was budgeted. The amount released is unknown. On Basic Healthcare Provision Fund, the budget was 282.6 billion naira, but only 32.9 billion naira was disbursed at the end of 2025. How does this impact on the healthcare sector?